Happy Wednesday. Y'all know what time it is. It's time for a Soulibration. Hi, I'm your host, Shameika Rhymes. Let me know where you are watching from in the chat, how you're doing, how your week has been going, because this week has been rough, y'all. But remember to share this with your network. And if you have any questions, y'all know what to do. Y'all are the co-hosts. Drop it in the chat. So tonight we are talking about an important topic, which is why I'm wearing, I keep yelling mustard, but it's yellow. But tonight is really talking about how for many Black women, getting diagnosed with endometriosis is a long, frustrating battle. And we had a show, I think it was last week, where we discussed that there was an issue with Black women being diagnosed in a timely fashion. So there's the dismissed symptoms, misdiagnosis, medical bias, and it creates roadblocks that leave women suffering in silence. So tonight, we're going to talk about how to break through those barriers, push for a faster diagnosis, and explore real pain relief options that work. We'll discuss why so many women are going undiagnosed, what tests and doctors to request, and how to navigate insurance and medical gaslighting. So we're also going to look at why some treatments fail, when surgery is actually worth considering, and alternative therapies that are changing the game for many managing endometriosis. So I see Asheville, Gastonia. I see Charlotte, Augusta. Welcome, welcome, y'all. I'm super excited that you're in the chat tonight. So if you're tired of being told that your pain is normal, you can push through, then you definitely want to check tonight out. And if you know anybody that's going through that, make sure to share this with them. So I'm excited about tonight's guest. She's been on our channel on blackdoctor.org before, Dr. Donna Adams Pickett. She is a renowned expert in the field of Black maternal health, dedicated to addressing the disparities faced by Black women during pregnancy and childbirth. So I am excited that she is back tonight. Let's welcome Dr. Adams Pickett.
Hi, Shameika.
Hi, how are you?
I'm great. I'm so happy to be here.
I am excited to dive into this because we did have a special, I think it was last week, all my weeks are running together, but I think it was last week where we were talking to some patients, and the patients were talking about, there was one young lady, she said it took 15 years before she got a diagnosis. So I wanted to make sure that we talk about why it's taking so long for women to be diagnosed and why so many are suffering in silence. So I think the first place we start is explaining what endometriosis is for those that are just tuning in.
Okay, great. When I tell you I'm excited about having this discussion, I had two patients today that I told them to tune in tonight for this. All right, so you know me from the last time. I love my visual aids here.
Yes.
So I have a little diagram here for you. So let's talk about what normally happens every month. Every month, your ovary releases an egg, and then you get the formation of this little lining here, that little red lining there. And that lining, if an egg is not fertilized, it just falls on off. But let me tell you, it does not fall off gracefully. It actually fills with really warm fluid, body temperature fluid. Remember, your body temperature is almost 100 degrees, 98.6. It actually swells up, and it practically rips off the uterus. It has to kind of peel off the uterus. So this little red stuff, when it comes off, it really pulls, and most people will have a little bit of cramping, a little bit of discomfort at the time of their period. Well, let me show you what's happening with endometriosis. With endometriosis, that red lining, can you see? It's all over the place. It's not just inside of the uterus. It's on top of the tubes. It's on top of the uterus. It's on the ovaries. It's in the pelvis. It's on the bowels. And the thing is, that lining doesn't realize that it's in the wrong place. It thinks that it's inside of the uterus. So when your ovary gives the signal to fill with fluid, to get real tight and to twist, it's going to do that wherever it is. It's going to try to rip wherever it is. So this tissue, if it's sitting on your bladder, is going to try to rip on your bladder. If it's sitting on your bowels or your rectum, it's going to try to rip on your rectum. And that's why many patients with this disease process, they'll have bleeding in their urine. They'll have bleeding when they have bowel movements. They'll have back pain because those little implants think they're inside of the uterus and they're trying to rip wherever they are.
Thank you for that explanation, because, and with the visual aids, because I could never really understand it, but I appreciate a visual aid to walk us through it. So thank you for that.
Good. I hope that made it clear.
It did, because actually seeing it and where it's just kind of everywhere, because, you hear people say, oh yeah, I've heard women say, oh yeah, I had endometriosis on covering, my bladder, or my appendix, or wherever. And I'm like, how did it get there? So this helps to explain it.
Yeah. And that explains why there is so much pain. Can you imagine something ripping on your appendix, ripping in your lungs, ripping on, and it's just ripping and tearing, and it's doing it every single month.
Yeah. I do see some comments saying the visual aids are a plus. So thank you. Yeah, there's some appreciation there for that.
Good.
So with that being said, and women are experiencing, with the bleeding, the pain, why is it taking so long for Black women to get that diagnosis?
So I think it's two things. I think it's our community, the medical community, because the hallmark of endometriosis is pain. I mean, that is, you may or may not have heavy bleeding, but you will definitely have the pain. You'll have severe pain during your period, and you'll have pain at other times. You'll have pain during intimacy. You'll sometimes, again, have pain during having bowel movements. Our community has kind of taught us strong Black women don't tap into our pain. We are put some tussin on it. Girl, you better wipe your face and go to work, wipe your face and go to school. So we are taught that I just have bad periods. So a lot of times, I can't tell you how many times I'll ask a patient as an afterthought after doing her exam, I'll say, do you have bad periods? Because that's not what they came in for. And they'll say, yeah, I do. As a matter of fact, they didn't think that it was okay to complain. They felt like it was complaining. And we're not allowed to lean into that. And in my community, the medical community, on our end, we buy into the strong Black woman trope. So if a patient comes in and you're not familiar with our community, and a patient is not weeping or appear very broken about it, then my colleagues will say, well, she can't be in that much pain. It can't be that severe.
Right.
So it's dismissed.
And that is so sad. It just was making me think something you just brought up about the, we are taught not to complain, but even, I know my situation was different. I had fibroids, but I do know someone, she thought she had fibroids, but had endometriosis, and but her endometriosis wasn't found until they were in there to have to do surgery for fibroids. But we were both talking about how we didn't realize that our periods weren't normal. So we weren't thinking to tell the doctor that they were bad, because it's like, oh yeah, cramps. Everybody has cramps. Oh, everybody probably just has those heavy bleeding days, 3-4 times, day 3, I guess 3 or 4 days out of the period, or maybe it's a little extended. We just that's normal, which is
Right.
crazy in hindsight.
Right. And in a huge component of endometriosis is genetic. That if you have a first degree relative with endometriosis, there's a 7 to 10% chance, 7 out of 10% chance that you'll have endometriosis as well. So again, in our community, we just say, oh, your mama had bad periods. Oh, my grandmama had bad periods. So again, we don't think to notice as abnormal because all the generations ahead of us have had that difficulty with it.
That makes sense. Yeah, and I think there was someone that also mentioned before that they didn't know that anybody in their family had it because they don't talk about it. It's, and that's the other problem. If nobody's talking about it, how would they know?
Right. Thank God for blackdoctors.org.
Listen.
I mean, for us to have conversations like this, there is somebody tonight that's going to have this conversation with their family members and open that door.
That's true. So what are some early signs that women should push their doctor to we need to investigate a little bit further? We mentioned the bad period, but is there something specific, like if there's a pain in a certain spot, or I know for some there's the fatigue, there's I'm just trying to think of what friends and stuff have told me before in the past about just the not being able to get up physically and go to work, or just bleeding for an entire month at a time.
Right. So one thing, and I do want to touch a little bit again about the pain with the periods, because when we see the pain becoming progressively worse. So if you started off with, okay, I've had painful periods since I first started, but as I get older, they're becoming more and more and more painful. That's usually an indicator of endometriosis. If you start having other pains that are random, like leg pain, abdominal pain, chest pain, but it exacerbates, it ratchets it up during your period, that's an indicator of endometriosis. If you're having worsening pain with intercourse, particularly with deep penetration, and particularly with certain positions where your uterus can't move and you didn't have those issues before, can be an indicator of endometriosis. And like I mentioned earlier, if you're having bleeding in your urine and bleeding when you have bowel movements, particularly during the time of your period, those are things that can be an indicator.
So with that, I can't tell you how many people, and I don't know if everybody else talks to their friends like this, but how many people will say,
they should.
It's just hemorrhoids, and you're like, are you sure? Because that don't sound like just hemorrhoids. They may think that that's what it is, that bleeding from the rectum. They may not realize that that it could be endometriosis. And let's see, there was a comment saying, Tamika Smith said she's hit 40, she's 40 years old, and her endometriosis is on a whole different level. So does it get worse as you age?
It does, particularly if it hasn't been suppressed any. So I have a family member, and I asked her if I could mention it tonight. She would cough up blood every time during her period, what we call catamenial hemoptysis. And she finally got bronch in her lungs, and it was endometriosis there. So, unless we have suppressed the inflammation, it will get worse. Okay, going back to my picture of the little things all over the place. To your body, that's a foreign object. So when your body sees these little things here, there, and everywhere, your body says, hey, that's foreign. So then your immune system begins to upregulate. You have a component of your immune system called macrophages. They're like little Pac-Men. The Pac-Men are going to come in and start trying to eat away at those implants, but they're going to end up leaving scarring and damage there, so that the next month, not only are you dealing with the pain from the implant, now you're dealing with the pain from the scar.
Okay, I'm glad you brought that up because I was wondering where all the scarring comes from, because I do hear, when some people are saying they have to go for another surgery to have some of that cleaned out. And then I'm like, where did it come from? What is it? Yeah. So
it's that
explains
inflammation. That inflammation in the Pac-Man.
I see Dr. Adams is nailing it. Yes, he is getting us together on endometriosis, and I'm here for it. Thank you. Thank you.
I'm looking for some endometriosis scholars by the end of tonight.
Right. Yeah, they're saying it's the best description they've ever heard. I love that. And I agree, because I've never heard it broken down like this before. So why do so many women get misdiagnosed with, fibroids or pelvic inflammatory disease before finding out it is ultimately endometriosis?
Right. I think, again, going back to my community, we have to remind me and my colleagues that the human body is capable of doing more than one thing at the same time. I again, a patient who I recently diagnosed, she was sent to me for uterine fibroids from the ER, but her symptoms sounded like endometriosis. And I kind of skipped a step and went straight to an MRI for her, because I felt like she had two things going on at the same time. And she did. She had endometriosis and she had uterine fibroids. And so I think we need to go in with that open mind of what else can be happening in addition to this.
Right. Yeah, because I think I've heard so many instances where it has been more than one thing. Even with a surgery, someone I know went in for appendix pain, and when they got in there, it was, did you know you had endometriosis? Like, it was wrapped all over the appendix and everything else in there. Yeah. So, but it made sense because of the period pain, the bleeding, and just all of the symptoms made sense. So are there any specific tests that women should be asking for when they go to the doctor with their, because if some doctors are just like, it ain't hurting that bad, take some Tylenol or some Midol, you're okay.
Right. Well, unfortunately, there's not a specific test for endometriosis, but I do feel like a transvaginal ultrasound at minimum we should begin there.
Yeah.
Because sometimes you may find that the endometriosis has actually coalesced into the ovary, and you have an endometrioma, which is basically a tumor or a cyst full of endometriosis, and that can affect fertility. And you may not necessarily have overt symptoms from that. There are a number of patients with endometriosis who don't have symptoms, but you may think, well, again, I may be having digestive pain, but the digestive pain worsens with my period, and that's the same. Well, can I get a transvaginal ultrasound? I just want to look in my pelvis to see if there's something truly abnormal going on.
And we had a patient last week's show that mentioned that that's how her endometriosis was found. Because she was trying to get pregnant, and she asked for that, and that's when they found that. So they were able to, take action. So what is endometrial cancer? Is that related to endometriosis? What's the difference there?
It isn't. And I'm glad you asked the question, because a lot of patients with endometriosis, they really do have a fear that it is a precursor to endometrial cancer. And it isn't at all. Going back to my visual aid here, we'll pull it back up. Okay. So the endometrial cancer is when there is just cancer that's located to this lining, or cancer involving this muscle here. But it doesn't have anything to do with this lining leaving the body in any way.
Oh, okay. So are there warning signs of endometrial cancer, or is that another thing that just kind of once you go in there, that's when you find it?
So the main warning sign again, and when I say I wish I could reach through here and hug you on this question,
Mhm.
is heavy menstrual bleeding. And for most African American women, we again think, well, everybody has heavy menstrual bleeding. So let me tell you what's considered abnormal, friends. Abnormal bleeding is, we say, 8 days and 80 milliliters. So you don't have to go around and measure your menses, but if you're soaking through a pad in an hour or a tampon in 2 hours, that's abnormal. If you're passing blood clots that are larger than a quarter, that is abnormal. And again, if you're bleeding 8 days or longer, that is abnormal. That merits an ultrasound so that we can take a picture of that lining, the little red thing that I showed. If it's thickened, if it's a lot thicker than it normally should be, we need to biopsy it. I can't tell you how many women, particularly women of color, have come in thinking I'm bleeding heavily because of my fibroids, and then they found that they have uterine cancer.
Oh, wow. Wow. Yeah, I had, until I was putting this show together, I had never heard of endometrial cancer because you don't hear a lot about it. Yeah.
So endometrial cancer is cancer of the uterus and the uterine lining.
So how can Black women advocate for themselves, especially the doctors, when they go in, they're dismissing their pain and other symptoms. It's kind of like, it's that feeling. And I remember sitting in the car crying because I'm like, I know what I feel, you know, and she's just like, well, we'll just wait. You're okay. Take this pain medicine and get out of my office. But she wasn't that rude, but that's how it felt at the time.
How it felt. That's how it felt. The end result was you felt, get out of my office.
Yes. Yes. Right. Yeah. So how can, I mean, and then I see a question to piggyback that. Tamika Smith says she was denied a laparoscopy many times, even with genetics and the telltale signs of endometriosis. So why does it take so long for doctors to even approve that procedure?
So I'm gonna hit that. I'm gonna answer your question first, and then because I'm glad she asked that question. So first, having platforms like this where we can give you the things to say when you're able to say to the doctor, I'm soaking through a pad in an hour and a tampon in 2 hours. I am passing blood clots larger than a quarter. I am bleeding for 8 days or longer. If they are a clinician that is truly basing their care in evidence-based medicine, they know that that should trigger a workup. And when it comes to pain, when you have pain that interferes with your activities of daily living, meaning that, you know, you can barely get up and walk out the door and say, listen, I may not look like I'm in pain, or like the old folks say, I may not look like what I've been through, but I need you to know that these are when I say these words, it's true. I can barely hold it together. And pain, it is the body's check engine light. Something is going on the inside. So Tamika's question about the laparoscopy. So Tamika, we now know, we didn't know this 25 years ago. We now know that that laparoscopy is not the preferred method of diagnosis and treatment anymore. Because what we were doing was, we were taking you to surgery, we would see these lesions, and we would start burning them. Okay, thinking, poof, we made them go away. Awesome. Yeah. But what happens with the burn? We leave a scar. We know your body has the ability to make those implants and send them all over. So now we've sent you, you're going to make more. Your body is going to scar already because you've made more. And now we have added scarring to you by burning it, which we still do. But now we feel like we should try all the other things first before we do that, that should really be our Hail Mary, because we know your body's going to make those implants again, and we don't want them making them on top of additional scarring.
So that brings me to piggyback on Tamika's question, because, and I've heard this from a few women, that they go in, the doctor says, oh, if they do get a doctor that says, oh, it sounds like endometriosis, hysterectomy. Why is that the first thing that some doctors go to without even really getting in there to see what's going on?
Now I have a problem with that. I have a big problem. I have a big problem with that. Listen, we're able to put people on the moon. We let astronauts who went into space for 9 days stay for 9 months. We have enough technology that we can try other things before we automatically do definitive surgery. Now, I will say this. I have had patients who have had such extensive disease, but usually it's with something else. So if they tell me, you know, if I look at, say, the MRI and I see that they have lesions on their bowel, on their diaphragm, on their bladder, on the side walls, and say they have a uterus that's the size of a basketball or larger at the same time, then there may be a discussion about hysterectomy initially.
Okay.
But that's an exception. That's a rare occurrence. Typically, we try the conservative measures first, and if all else fails, then go to the hysterectomy.
Now, what about for someone that has been through multiple go in and burn the lesions and I forgot what you call them, but burns all that, and there's just scar tissues. They've had multiple surgeries, and they're like asking, can we just do a hysterectomy because I don't have a good quality of life? And because I've heard that they had been denied multiple times until, like, you know, a surgeon just gave in, like, okay, if you're sure you don't want kids.
And I have a problem with that too. I mean, because patient autonomy, you know, ultimately you want patients to make informed decisions. But again, that's not living. That is not living. And, you know, as I mentioned before, every single time you go in, you're going under the risk of anesthesia complications. And then every time we go in, we're burning tissue. And particularly if you say have implants, again, on sensitive structures like your rectum and your large bowel and your diaphragm, you have every right to request definitive surgery. And I have done it. I have done it for, you know, younger patients under the age of 40 who have said, I am not living like this. And I have said, I understand. Let's do it.
I'm so glad to hear you say that, because I remember, you know, hearing this person. They were, you know, I don't remember the age, like early 30s. And this had been going on for a long time. And it was doctor going from doctor to doctor, and all they wanted to do was surgery. So which brings me to my going backwards a little bit. What are the other measures that you do try before you get to the definitive hysterectomy?
So we have a number of medications available now that weren't even available when I first started practicing 24, 25 years ago. So we know hormonal therapy to basically suppress that response. Remember, the inflammation is because the body thinks it has to rip this lining off. And so the times that doesn't happen is when we suppress ovulation. And suppressing ovulation with oral contraceptives or with an IUD, we usually try to see if we can start you with something that only has progesterone in it only first, because sometimes the estrogen itself can cause some local inflammation. For people who really don't want any hormones, we try to control the local inflammation with what we call non-steroidal anti-inflammatory. So that's like your naproxen, your ibuprofen, your Tylenol, but taking it on a schedule and taking it just before your period. There are a number of categories of medicines. They're called GnRH antagonists and agonists. And what they do essentially is tell the ovaries, go to sleep. Go to sleep. Don't stimulate anything. Don't stimulate an egg. Don't stimulate a endometrial lining. And so essentially you're in like a chemical state of menopause because we have put the sleeper hold on the ovaries. With those medications, there's usually a limitation of time that you can be on them. So the tablets, no more than 2 years, and the injections no more than a year. With the injection, you can go longer than a year, but then we have to give you hormones to protect your bones afterwards. Mm-hmm. So those can be, and a lot of times now that's what we use for diagnosis. If a patient, instead of going to surgery, if a patient has a history that's suggestive of endometriosis, and we start you on those medications and all of the symptoms get better, that's enough for us to say this is likely endometriosis.
Wow. Tamika has another question before I get to my next question. She wants to know, so, and this is a great question. So is everyone with endometriosis given a stage, like stage 1, stage 4, or should they receive a stage when they're given that diagnosis?
So you can only stage surgically.
Mm-hmm.
So you can only provide staging by going in laparoscopically and taking a look around and seeing where the implants are, what the ovaries and uterus are doing in response to the implant, and during the staging there. Sometimes you can see where those implants are on the MRI, but ultimately you cannot do staging without doing surgery.
Okay. So with the hysterectomy, because I think some people do think it's going to cure everything, does it make all the pain and everything go away? Is endometriosis just gone if you do have the hysterectomy?
Well, for the most part, if you do the hysterectomy for endometriosis, it is advised that you take the ovaries too. Because if you take the uterus out, remember, you may have implants anywhere. Yeah. Your ovaries are still going to trigger those implants. If that implant is in your right shoulder or in your jaw or whatever on the front of your abdomen, when your ovary sends the signal, that implant is still going to reply to that signal. So if you have a hysterectomy, then you need to have one with removal of your tubes and ovaries. And for the most part, most of the patients will feel better after that. There have been, I think it's like 5 to 10% of people have reported still having pain after a hysterectomy. It's a very small percentage. The larger percentage will feel totally better after everything is removed.
Okay. Is there anything, if you're having endometriosis symptoms or you've been diagnosed with endometriosis, is there anything you can do on your own, like with your lifestyle? Though for some it may be they are just suffering, so there's not too much they can do, but diet, what should that look like to kind of help with, I don't know if it will help manage pain or anything like that?
Well, there are some foods that are what we call high in estrogenic content. They're called phytoestrogens. Like when I have my patients who are menopausal, and I try to encourage them to eat those foods, like yams and brown rice, licorice, eggs, soy, red clover. But that high estrogen content may actually worsen or exacerbate a patient with endometriosis. So you would want to try to decrease those phytoestrogens in your diet. There's been some studies that shows that fenugreek and valerian root can be helpful for symptoms and for decreasing some of the inflammation. But what they really kind of address is the symptoms, but not controlling it. So I think maybe it was Tamika who mentioned that her endometriosis got worse each year. It's because she was making more and more and more implants. The natural regimens won't stop that process, but they'll just stop you from feeling as much.
So it sounds like endometriosis, because I mean, I've shared before, I have fibroids. So I know the mental gymnastics through that. But what have you heard from your patients as to the effect endometriosis has on their mental health? And how do you advise, even the people watching, how can they find some support?
Well, it is such a drain on your emotional well-being, because no one wants to walk around with the background noise of pain all the time. Because what people don't realize with endometriosis, the pain just gets worse with your period. But for most part, it's always there.
Yeah.
The volume just gets turned up during your period. So when you can't enjoy intimacy with your partner, you can't enjoy going on a girlfriend's trip because the pain is always there. That's problematic. And then the other thing I really would like to make sure we address is that even though there's no cure for endometriosis, when we feel like it may be a factor for a younger patient, we should have that discussion sooner versus later if they desire childbearing. If they say had on their radar, I was planning to have children at 35, 40. Well, if we feel like you have endometriosis at 23, 24, then we need to go ahead and have the discussion now that maybe you need to have your children earlier than that. You need to have your children within the next year or two, because it's just going to worsen as Tamika's did. And we wait until we get to 35, and now we're in the throes of infertility.
Okay. Which that alone can also do a lot for your mental health too. So I think one of the things, and it wasn't on my list of questions, but it just made me think about when you're dealing with all this and you still got to get up and go to work, it is, and I don't know if you can speak on this, that dealing with the FMLA, or if endometriosis is something you can, take time off work for during that time of the month, because it is so painful. Do you have patients that do that?
Listen, before you said FMLA, I was about to say I have done FMLA paperwork for patients with endometriosis. I have. And I think what becomes a problem for me is that the patients still have bosses, supervisors, co-workers who minimize it. Well, who doesn't come to work because they're having their period?
Right.
They don't understand the severity of this individual's period. If basically you're feeling your period in your bowels, if you're feeling your periods in your liver, you're feeling your periods in your lungs, your periods they're not going to be like Susie's periods, and Susie may have an issue with that.
Yeah. Do you have suggestions for how to navigate that? Because Susie can be very
passive aggressive about it. The problem is that I'm 1968, baby. I don't care. But this is when, again, when we have platforms like this and we can empower people to speak freely about their condition.
Yeah.
That, that they don't have shame about it, that they, say, well, I've been diagnosed with endometriosis. When people have diabetes, they don't have a problem saying that I have diabetes. I have to take blood pressure medicine for my high blood pressure. I have gout, and when the person has gout flares, they're not at work. So I think being able to empower our listeners to be able to say, hey, I have endometriosis and I have severe endometriosis all over my pelvis. And so every month, essentially, my entire body is set on fire.
Mm-hmm.
And it makes it difficult for me to function. And there are very few medications that can control it.
Mm-hmm. That's a great way to do it. I was thinking I could be passive aggressive too and email Susie the link to this. Check this out.
Yeah, that's right, too. Susie, don't come to my friend.
Exactly. Y'all better not listen to me. I don't want y'all to get fired.
That's right. Dr. Pickett, are you gonna hire me? I got let go.
Well, what final advice do you have for Black women that are struggling silently?
Mm-hmm.
And maybe they are afraid to go to the doctor. Maybe they, their doctor hasn't listened at all. What is that advice that you have for them as we wrap up?
I think first to acknowledge that your pain and your symptoms are real. They are not in your head. And sometimes you actually have to walk in with like a pain diary or a symptom diary. And that actually can demonstrate, I have this leg pain. Some people have it in their leg. I have this leg pain that's worsened with my periods. But I don't have it any other time, or I have it, but it's worse with my periods. And sometimes you do have to find someone who is willing to have that conversation with you. And if that means getting a second opinion, a third opinion, then fourth opinion, do that.
Yeah. I see someone else said document your pain in a journal. So yes, great advice. Great advice. So this conversation has been so good. Like, I'm like, no, I don't want it to end, or we'll have to do a part 2, or you'll have to
part 2.
Well, we already talked about you're coming back for some other stuff later.
That's right.
But for my last question, and I didn't include it on the ones I sent over because I wanted to surprise you.
Okay.
What feeds your soul?
Whew. What feeds my soul is 2 things. Okay. 2 things. My children, of course, because it's this really like the embodiment of everything God could have done, the best parts of you outside of you. What feeds my soul is feeling like I'm making a difference.
Yeah. I think you are. Yeah. Well, I want to thank you so much for coming on and breaking endometriosis down for us. Because like Tamika said, you broke it down perfectly in a way that was easy to understand and to visualize.
Yes.
I love a visual aid too. So thank you for bringing that along as well. For more information, everyone, about endometriosis, you can head over to blackdoctor.org and search for articles there. And I did see some people asking if there's a way to reach out to you on social media if they have other questions.
So my Facebook handle is Dr. Donna, the Girlfriend's GYN. On Instagram, it's the same, Dr. Donna _ the Girlfriend's GYN. And on TikTok, I am the Girlfriend's GYN.
I think that's a perfect name, actually. That is a perfect name.
Hanging out and chatting.
Exactly. Well, y'all, coming up next week on Soulibration, I'm excited about this one. The iconic, legendary Melba Moore is coming, y'all. She's going to be talking about, staying fit at 79 years old. I don't know if y'all have seen, that woman can still kick her leg up as if like it's nothing. So she's going to talk about how she stays fit, how she can still hit them high notes. She's going to talk about the power of you can reinvent yourself and start over at any age. And of course, the power of music and its healing properties. So y'all, I'm excited because she's proving that it does not matter how old you are. You can still be out here kicking your leg up, singing, doing all the things. And, she is our auntie on social media. So I'm excited that Melba will be joining us next week. So I hope you all have a soul-filled rest of the week, and I will see you then. Have a good night.